Good morning, and I want to thank you all for joining us. Today we're going to discuss the latest on COVID-19 virus, previously known as coronavirus, and what Arizona is doing to protect public health, prepare for the potential of further cases, and minimize the risk to Arizonans. Public health and safety are the most important responsibilities of state government, and we are taking this threat seriously. I've been receiving daily briefings on the situation and continuous updates as it evolves to make sure all steps are being taken to protect public health. This morning I was briefed by Vice President Pence and senior administration officials on the latest when it comes to the national response. They committed to continue working with us, provide any support that we need, and staying in close and frequent communication. When it comes to our response and preparation here in Arizona, we have an outstanding team at the Arizona Department of Health Services led by Dr. Cara Christ. And I believe that there's no one better in the country at this. Not only is Dr. Christ a medical doctor, an infectious disease epidemiologist, and a public health expert, but she also holds a master's degree in molecular biology, and she led the state of Arizona's response to the H1N1 pandemic in 2009. Dr. Christ and her team navigated Arizona through that outbreak, the 2014 Ebola outbreak, and the 2016 measles outbreak. Along with our partners at the Department of Emergency and Military Affairs and other statewide agencies, county and local health departments, and those at the Centers for Disease Control, Arizona is in good hands, and I'm confident in this team's ability to manage this situation. With that, it's important for everyone to hear from the experts on this issue. So I'd like to turn it over to the Director of the Arizona Department of Health Services, Dr. Cara Christ. Doctor?
Thank you, Governor Ducey, for the introduction and for your leadership to ensure the health and safety of our communities. I'd also like to thank Director Jamie Snyder and Director Wendy Smith-Reeve for joining us here today. I want to start by saying that I understand the news of this new virus spreading around the world, including the United States, can cause fear and anxiety about how to keep ourselves and our loved ones safe. I empathize with your concerns, because while my day job is the director of the Arizona Department of Health Services, my most important job is as a mother of 3 young children who attend public school, play sports, and attend events in the Valley. My family and I live, work, learn, and play in this community. Every decision we make to control the spread of this disease in our state not only affects your family, but it affects mine and my colleagues. I can assure you that the top priority of every data-driven and evidence-based action that we take is to keep our communities and families safe while having as minimal of an impact on Arizonans' daily lives as possible. So let's start with the things that we know. So COVID-19, which was previously called novel coronavirus, is a respiratory infection that can range from mild to severe, and in severe cases can be fatal. We heard the news this weekend about the first fatal cases in the United States from the disease in Washington, and our thoughts are with those families who are dealing with this tragic loss. People most at risk for becoming infected with COVID-19 are those with recent travel to an area with ongoing transmission of the disease, and people with close contact to somebody who was diagnosed or suspected of having COVID-19. The virus is spread by person to person, either from close contact with an infected person or contact with respiratory droplets produced when an infected person coughs or sneezes. Symptoms can appear within 2 to 14 days after exposure and are very similar to flu. These include fever, cough, and shortness of breath. While the majority of people with the disease have experienced mild symptoms, certain people are at higher risk of severe disease, like the elderly and/or those with underlying chronic medical conditions. So as of today, in Arizona, there has been one confirmed case of COVID-19. This case was in a person with a history of travel to Wuhan, China. Thankfully, this person has recovered and is no longer infected with the disease. We have tested 26 Arizonans for COVID-19, and 24 of them have been found not to be infected. As of this morning, we have one patient in the state with pending lab results for COVID-19. There have been no deaths in Arizona from COVID-19. Moving forward, these numbers will be posted on our website. There is currently no vaccine or treatment for COVID-19. However, this is a rapidly evolving response, and my team is constantly watching the world. There are now several cases of COVID-19 in the United States in people without a travel history to an affected area. So we know the disease is spreading, and we can expect additional cases in Arizona. When a new disease like COVID-19 is detected, only the most severe cases are initially identified. As we learn more about the emerging disease, we expand who we are testing based on improved understanding of the symptoms and the disease spread. The CDC recently expanded the case definition of who should be tested. Based on this, we expect we will have additional cases in Arizona. But we want to assure you this is typical in disease surveillance. The more we're looking for cases, the more we're going to find. An increase in the number of cases does not necessarily mean the disease is more severe. But what is Arizona doing? The public health system in Arizona is well prepared to respond to a possible pandemic of COVID-19. Since this virus spreads very similarly to the flu, we are guided by the state's existing pandemic influenza response plan. This plan was last updated in May of 2019. Most of my leadership team, including myself, were at the Department of Health Services and held key roles during the state's 2009 H1N1 response. We have decades of experience preparing and responding to public health issues. The Arizona State Public Health Lab has begun testing for COVID-19 today, which means we will no longer need to send approved samples to the CDC. Our state public health lab has the capacity to test up to 450 samples per day. And we do not anticipate any shortages in test kits for our state public health lab to test for this disease. We're also working very closely with our local public health partners and our federal partners to identify cases and prepare the community for the possible spread of the virus. We are creating and distributing guidance for partners including healthcare, first responders, schools and child care centers, universities, law enforcement, businesses, and other community partners. We are communicating closely with the CDC and other federal partners to maintain situational awareness about the latest developments, and we share this information with our partners and the public. Our Health Emergency Operations Center was activated on January 26th and continues to be activated to provide support to our public health partners and infrastructure to respond to this outbreak. But what can the public do to help? There are several steps that individuals, families, and employers can take to help stop the spread of this disease. Individuals can take precautions very similar to what we recommend for other respiratory diseases. The best ways to prevent this spread are to wash your hands often with soap and water for at least 20 seconds. If that is not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. And please stay home when you are sick. Cover your cough or sneeze with a tissue, then immediately throw it into the trash. Clean and disinfect frequently touched objects and surfaces. And if you are sick and need to see a healthcare provider, consider utilizing telemedicine to lower the burden on our healthcare system. For employers, now is a good time to take steps to prepare for potential community spread and ensure plans are in place to deal with absenteeism. We recommend that employers have a continuity of operations plan or a COOP plan. This plan should assess your essential functions and the reliance that others and the community have on your services or products. Be prepared to change your business practice if needed to maintain critical operations. For example, identify alternative suppliers, prioritize customers, or temporarily suspend some of your operations if needed. Cross-train staff to perform essential functions so the workplace is able to operate even if key staff members are absent, and ensure teleworking agreements are up to date for employees that can telework. And encourage your employees to stay home when they are sick. You can also perform routine environmental cleaning by regularly cleaning all frequently touched surfaces in the workplace, such as workstations, countertops, and doorknobs. You can use cleaning agents that are usually used in these areas, and there is no additional disinfection beyond routine cleaning recommended at this time. Provide disposable wipes and allow or provide the ability for employees to wash their hands with soap and water or to have access to hand sanitizer. For people who are planning to travel, check the CDC's updated travel advisories for areas affected by COVID-19. There is a link to these travel advisories on our website. And if you have recently traveled to an area that is impacted by COVID-19 and you develop fever with cough or shortness of breath within 14 days of travel, please call your healthcare provider. If you do not have a healthcare provider, you may need to be seen at your local urgent care center or emergency department. Before you go to any doctor's office, emergency room, or urgent care facility, call ahead and tell them about your symptoms and your recent travel or contact with a person infected with COVID-19. This way they can protect their healthcare workers and other patients at the facility. I urge everyone to find reputable sources for information about COVID-19 and don't spread inaccurate information. Your public health departments are great sources that will provide factual and up-to-date information. ADHS has a website dedicated to COVID-19 that is updated daily. You can find the most up-to-date information about the disease at azhealth.gov/COVID-19. You can also contact your local health departments, such as the Maricopa County Department of Public Health or the Pima County Health Department, for the most up-to-date news about the virus in your community. A link to find your local public health department can be found on our website. The CDC also provides current updates at cdc.gov about the latest information. Again, I want to assure everyone that the public health system in Arizona is well prepared to respond to the spread of COVID-19 in Arizona. We will continue to provide the public with the most up-to-date information and advice on how to keep yourself and your loved ones safe. We'll now have time for a few questions from the media.
Let's start over here. Doctor, this question for both you and for the governor. We've heard reports of various shortages of things, starting with masks, starting with things like sanitizers and everything else. What items are you, both of you, stockpiling or buying, and what do you think most people should be stockpiling and buying? What are you personally doing?
Things that we are dealing with from a public health system to ensure that our healthcare system has adequate supplies would be masks. We do have a supply of masks that remain from previous responses. We encourage the public, it is not recommended that if you are not symptomatic or have not been told by your healthcare provider to wear a mask, please do not wear masks. They are not recommended at this time. We are currently working with FDA and CDC as well as our local health departments and our hospitals to identify if they have any needs and to be able to reallocate resources around the state.
Understood, but I guess the question is both of you on a personal level. You've got 3 children. What do you, I was at Costco yesterday. I won't tell you what I saw people walking out with. What are you personally buying? What are you and Angela personally buying, Governor?
As of right now, for my family, we are keeping things very normal. I am not stockpiling food or water. I am making sure that I have appointments for my children to, if they've got medication, to make sure that I have access to those medications. But right now, I'm not stockpiling food or water.
My answer would be similar to Director Christ's answer.
Dennis?
That question for the governor, why wasn't the public alerted beforehand after we received defective test kits? I mean, this hindered the ability to respond to this, and we found out last week that there was defective kits here. How come there wasn't more information provided about that before today?
As we've had information, we've made certain that the public has had that information. To my understanding, the state of Arizona was cleared for proper testing on Friday, and that's where we've been.
Know that these kits were defective before then?
So I can answer that question. So we had been working with the Centers for Disease Control. We were one of a large number of states, about 37 states, who were unable to validate because of a third primer. We were working with CDC as they were working through their system. So it wasn't that it was faulty, it was the way that the primer worked. And so as they were able to determine that that third primer wasn't needed, they gave the states the go-ahead to test without that.
When did you guys first learn that whatever the issue was, you couldn't validate? When did you guys first learn that?
Oh, goodness. I'm not sure of the exact date, but it was reported within the, I want to say, maybe the 11th, maybe the 12th. Well, there wasn't any difference in how that changed our testing. So while we would have been able to do it faster here, the CDC was still able to provide testing for public health purposes.
We're going to come over here to this gentleman here. We're going to make sure we get as many people as possible.
So now that we are testing locally, what is the turnaround time for results?
So the turnaround time will either be same day or next day, depending on when we receive the samples here at the state lab.
Mark, did you have a question?
Yes, it's two-part, Doctor. One is, do you see that the fact that we had an early case as sort of a blessing in disguise in that it put Arizona on notice about the virus? That would be the first question. And I'll wait for your answer.
Yes, I think that it was a blessing in disguise. Because of that first case, that is when we activated our Health Emergency Operations Center. We had been doing activities and monitoring what was going on worldwide, but that kind of brought it together and allowed us to accelerate a lot of the different guidance and information that we're putting together now.
And the second part of that, professional opinion. Why do you think we've so far sort of dodged the bullet here? To have only one case and one pending an outcome, having been, an early state to have a diagnosis. Any thoughts?
I'm not sure I know the whole answer. I think that there are a lot of factors that play a role. So I think one of the factors is the fact that they're screening at those intake airports within the United States on anybody returning from those high-risk areas. And so I think that that has limited those that may have potential exposure. We're monitoring travelers here in Arizona so that people who are coming from mainland China are followed up with public health. I also think that, as we expand our testing criteria, we will get additional cases.
We're going to go here next to Mark, and then we'll go to Graham. Go ahead.
Is there a concern for people handling the lab tests? Is there a way to protect them?
So there's always a risk of our lab personnel being exposed. We follow the CDC's guidance on lab safety in order to minimize that exposure.
Graham?
Thank you. A couple questions about the test. A number you threw out a few minutes ago. You said 26 people have been tested, 24 were not infected. Is that correct?
Yes.
And is one of them the ASU person?
One of them is the case and the other one is the pending.
Is the pending one? Okay. The test kits. There's some confusion over how many people can be tested on one kit. So when you say you can do 450 tests a day, is that 450 people or is it something else?
That's 450 specimens. So one individual may have multiple specimens depending on what they're collecting. If they're collecting a back of the throat swab, an up the nose swab, blood. And so every one of those is considered a specimen. So we can run 150 specimen at a time, and we can do 3 runs a day.
And when you put all these numbers out there, the 250 people being monitored and the 26 tests, does that include the Maricopa County numbers?
Yes, that includes statewide numbers.
Barbara, do you have a question?
I sure do, yeah. You mentioned guides pertaining to education, and we've been trying to get an idea about, especially with time being of the essence, what at least preliminary guidelines can you give to educators, to teachers, in dealing with this population, many of whom are a little bit immature to, practice good hygiene? What would you recommend right now?
So we would recommend to our educational partners to ensure that your kids are washing their hands frequently, using this as an opportunity to teach them how to do that. So happy birthday twice under the water with soap. Also to have hand sanitizer on hand, and then to make sure that you're encouraging parents to keep their children home when they're sick, and that they're working with their staff to identify what that looks like in the kids. We will actually be issuing school guidance this week for our school partners.
And what about, most importantly, they tend to not cover their mouths when they cough and touch each other's faces and the like. I mean, how do you handle those things?
So we would encourage teachers to make sure that they're telling the little ones, I have a kindergartner, to keep their hands to themselves, and that they need to wash their hands.
We're going to go to 10 and then AP. Two questions. First one, are there any changes being made at like elder care facilities or adult care facilities because this virus seems to affect the elderly population much more?
So we are working on guidance for our long-term care facilities here in Arizona. Those include our skilled nursing facilities. And so we will be giving them additional guidance on how to prevent the spread or transmission of this disease within their facilities.
And next, it's my understanding that Arizona is one of a handful of states, because we're now validated, we don't have to send the samples out to the CDC. Is there something about our lab here that makes that possible that other states don't have?
I believe that a number of states have become validated. Our lab, though, historically has leaned forward and has been one of the labs that comes online the earliest with Zika and Ebola. We have a phenomenal lab director and staff here that really work to get us onto the cutting edge for that.
JJ, this question to the governor. The president said recently that he's considering closing the southern border. Do you think that's a good idea?
Well, my first concern is for public health, of course, and there's going to be certain decisions that are made from Washington, D.C. One of the first ones was the travel restrictions back from China and the quarantines that were done at 11 American airports so that we could screen individuals. I'm going to defer to the subject matter experts in a situation like this when you're talking about a potential pandemic so that we make the proper decisions to protect public health.
Craig?
You mentioned you just had a briefing with the Vice President. Is that still being discussed, closing the border?
What was discussed was what the situation was on the ground. There were 52 governors and representatives from American territories, so all 50 states were covered along with territories. It was basically an overview of what the situation is now, who and how we can get in touch with the federal government and our partners. A briefing from the Secretary of Health and Human Services, Alex Azar, and commentary as well from the Centers for Disease Control and National Institute of Health with a conference call pending a week from today, and also officials within the administration that we could get in immediate touch with if necessary.
We'll come back here and then we'll go back to 15.
As of Friday, Dr. Lisa Villarreal from the department said that the risk for Arizonans was relatively low contracting the virus. Are you still considering it to be low, Dr. Christ?
So within Arizona, we still consider the risk to be low unless you have history of travel or contact with an infected person. However, as we're finding that there's community spread in the United States, the chances of coming into contact with that are heightened.
Right. And the second part, do you see weather in Arizona as a plus because we're starting to see warmer temperatures? Could this possibly help avoid, I mean, considering viruses tend to live in colder?
I think it's going to, so many factors play a role into how long disease will stay in the community. I think being able to get outdoors and not be confined with people touching the same surfaces is one of those things that diminishes the spread.
Mark, Governor, to you. I wanted to find out, have you had any discussions with other governors, Texas, for instance, regarding Arizona residents, citizens that are currently in other states that apparently can't go anywhere or currently, because of some sort of threat of the virus, they may have been infected, or has there been any sort of discussions along those lines with other governors about transferring people from one state to another who have been looked at?
Well, on the conference call and video conference this morning, like I said, all 50 governors were on there. The vice president called on a number of governors to talk about the situation in their state, of course, with what's happened in Washington State. Governor Jay Inslee. I've got a relationship with these governors. I've by and large have their cell phones, so if there's something that's necessary or we can act on in Arizona, we'll be communicating. But what you're describing has not been an issue to date.
I think we had a question back here. Go ahead.
Dr. Christ, can you say how frequently the state's website with diagnosis numbers will be updated? And the CDC is saying that they're going to update their numbers Monday, Wednesday, and Friday, and I was wondering if you think that's enough frequency of updates.
So we will be updating ours daily. I believe by 9 a.m. every morning is what we've decided. The CDC is updating Monday, Wednesday, and Friday, and I think that that's adequate for them because they're collecting the state's data. And now that the states are able to do their own testing and able to get kind of that real-time data, it's more helpful for the states.
We had a question up front here.
Yeah, this is for the governor. What are your thoughts on this othering of people within the Asian community?
Pardon me?
What are your thoughts on this othering of people within the Asian community in Arizona?
I'm not aware of it.
Okay, you haven't been hearing about like people not going to Asian markets because they're kind of afraid of the coronavirus, or like not going to Asian restaurants?
I've not heard that specifically. Whenever there's an emergency like this, there can be concern and alarm. And part of the reason that we're having this conference is to make sure people have the facts, that they know everything that we know, that they can, to the best of their ability, make the proper plans and precautions and go on living their life.
Barbara?
Yeah, and this is to the doctor again. As you know, Vice President Pence recommended against doing runs on masks, face masks. What would you say about the antiseptics, the wipes, the hand sanitizers? Do you fear that people might try to just hoard these items? What would you say to those folks? Should we stock up on those?
We would encourage the public not to do a run on like hand sanitizers or disinfecting wipes. Buy what you need so that the market can continue to support all Arizonans, and then as you need more, it should still be there. So we would not encourage that activity.
Let's do one more from Maria, who I didn't see on your side.
Hi, I know you said that the state doesn't anticipate any shortages in terms of the test kits. Are you able to say roughly how many we have on hand right now and what the process would be for getting more if you do need to test more individuals?
So I don't know exactly how many we have on hand. I know that we just received a shipment of additional testing supplies and reagents on Saturday. As we need additional ones, CDC is able to provide those to us. We just notify them that we need additional resources.
Thanks, everyone. That's about the time we have.
Can I just one more, because it's really important. Governor, we found out over the weekend that the legislature in 2002 gave you, as the governor, vast new powers, including mandatory vaccinations, including quarantine, including the National Guard. Have you reviewed those powers, and
what's your thoughts on the need for those powers?
Dr. Christ gave you an excellent summary of the situation. Dr. Christ, along with the Vice President and the Secretary of Health and Human Services, have said that the risk is low in Arizona and in the United States. And of course, I'm aware of the authorities under the governor. And if necessary and needed, I will use every tool possible to protect public health in Arizona. Thanks, everybody.
Thank you.